So we did have a big update at ACTRIMS. So the data was presented from the phase 3 clinical trial program for Evobrutinib. And so Evobrutinib was studied compared to Teriflunomide in 2 clinical trials, Evolution RMS1 and RMS2. Unfortunately, it was not superior to Teriflunomide. So in the Evolution RMS1 trial, the annualized relapse rate was 0.15 for Evobrutinib and 0.14 for Teriflunomide. And then in Evolution MS2, it was 0.11 in both groups. So about 1 relapse every 9 years. So it looks good for both agents, but not superior to Teriflunomide, which is actually generic now in the US. If you looked at some of the other outcomes like confirmed disability progression, there was no significant difference between the 2 agents. And actually, if you look at contrast-enhancing lesions, it was actually a little bit higher on Evobrutinib than Teriflunomide, but not statistically significant. And kind of the reversed on new and enlarging T2 lesions, a little higher. So you definitely you had a little higher amount on Teriflunomide than on Evobrutinib. The neurofilament light levels were also similar, so biomarker was pretty similar. Although it seemed like the patients that were on Evobrutinib had a quicker drop in neurofilament levels, which might be beneficial. So overall, unfortunately, a disappointing finish for Evobrutinib. We were expecting and hoping for another option for treatment for patients with relapsing forms of MS, but that was pretty much a negative trial. Both agents looking good, and overall safety looked favorable. Now, the other agent that we will be hearing more about later this year, and I've been involved in clinical trials, is Tolebrutinib. So that would be the next BTK that we're going to hear about. There was a study that was presented looking at, that was done at the National Institutes of Health, and it was looking at paramagnetic rim lesions. So these are lesions that have iron deposition around the perimeter. And the reason why they have iron is when myelin is broken down, iron gets deposited and microglia around the rim, and we think this is activated. So this was looking at Tolebrutinib to see if it removed. There was disappearance of these paramagnetic rims, and there was not. I'm still not sure if this medication would get in and actually remove iron from the brain. It's not a chelating agent, so for me, it was not much of a surprise that this didn't happen, but I guess there was some hope that it would make these lesions, rim lesions, get smaller or disappear. But again, it was only 7 patients done on 7 Tesla magnet at the National Institutes of Health.